Paul, first of all, thank you so much for joining us. I'm Katy Whalen. My husband Josh is here. We are the founders of Joi and Blokes, and we really appreciate you taking time to kind of share with our audience all things inflammation, which we know you know a lot about. We're hearing a lot about how it's kind of can be the root cause of a lot of disease, so I'm interested to dive in there. But I know we met through your colleague Ben Bickman, so would love to just kind of hear a little bit about who you are, what you do, and have you introduce yourself to everyone, and then we'll dive right into all the questions we got.
Yeah, that'd be great. Thanks again for having me. This is a great opportunity to talk about inflammation and disease, really, because that's kind of the unknown connection, or at least poorly perceived connection. So, Ben and I are in the same academic department. We're both in the cell biology and physiology department. I've known Ben since the day he arrived here at BYU, and we've been close collaborators and friends every step of the way. We run a really large lab, so we've got about 25 undergraduate students, a few graduate students, and just feel great pleasure to kind of instill a hope that these folks can develop a love of understanding how the body works. And then they'll go forth and go out into the world and share that beyond. So excited to be a part of the program.
Oh, wonderful. So let's dive right in. So you study inflammation and glycation specifically, or what is your specialty?
Yeah, absolutely. So my original training was in the area of pulmonary disease. So I studied mechanisms, how the body proceeds through the process of developing lungs and the respiratory system. And then from there, it just kind of branched out because this idea of glycation is key in the progression of COPD and other, lung type diseases. But it is so much more than that. There's so much more to the story, and there's a metabolic twist that we'll have a fun time talking about today.
Okay, so what is glycation?
Yeah, so glycation, or actually, if we could maybe take a step back and look at inflammation generally, it's such a,
Yeah.
a, a catch-all. It's talked about everywhere, social media, academic journals, and everywhere in between. So one thing that your audience may already know about is this basic idea of what it is. So at the core, inflammation is really your body's way of saying we've got a problem, right? It's the immune system's first line of defense.
Mhm.
Some people like to think of it as kind of like a fire alarm that goes off when something's burning. You twist your ankle, you get a splinter, that redness and swelling and the heat that you feel, that's inflammation doing its job. So it's a wonderful thing. We can't live without it. It is a survival mechanism. We'd be lost the first time a bug bites us if we didn't have inflammation. So it's key, but the issue that we need to grapple with is when it becomes rampant. And, let's imagine the process unfolds in steps, right? So let's say you begin with a trigger like a cut or a virus. Your cells detect that through a host of different receptors. And those receptors are kind of like little sentinels on patrol. They're always on the lookout. Blood vessels open up, immune cells flood in. That's the swelling and the warmth part of the story. But then chemicals like histamine and cytokines kick things into gear, really. They rally the troops, they signal, pain to keep you from poking at the wound. Once the threat's gone, repair crews like macrophages and others will clean up the mess and you're right back to normal. That's kind of the textbook version of the quick and effective way to go about fixing problems. But things can get dicey, right? What happens when the alarm keeps blaring? And that's kind of the bridge between the acute and the chronic
So
disease.
can I ask you,
Yeah.
relevant to our audience and
hmm
primarily our 30 to 55, 60-year-old men and women, what are some things that we can be doing as an audience to subside inflammation outside of an acute injury to live in a less inflamed state?
No, that's a great question. And that really dives into this whole idea about, diet and lifestyle. So what are the things that are stoking the fire? Well, diet is a big thing, right? Carbohydrates, especially refined ones, are front and center. If you eat a donut, your blood sugar will soar, insulin will spike, and your cells will get cranky. There was a really important study, 2017, I think it was, in diabetes care that tied high carb diets to chronic inflammation in metabolic syndrome patients, particularly. And The treatment of diabetes today accounts for almost one out of every four healthcare dollars. So it's this balance of carbohydrates that relate to inflammation that really might be the most help to your audience.
Wow. I didn't know that a quarter of all revenue or dollars spent was tied to that.
Yeah,
Crazy. I mean,
yeah,
that's an epidemic.
absolutely. And that's what kind of bridges to where, this idea of inflammation and glycation is really a connection that I think has been around forever for sure, as long as we have been, but the connections have been more clarified recently, and that's kind of where I've hung my hat lately in the areas of research.
So we got a good idea of inflammation. Give me more understanding of glycation, just what that word means and how it plays a role in the body tied to inflammation, the whole nine yards.
Perfect, perfect. So, Josh, the way it works is this. Maybe before we talk about glycation, it might be important to distinguish for your audience a similar process, but one that's entirely different, and that's called glycosylation. They sound similar, they have the same kind of roots to them, but it's very different. So let's mention those two in order. First off is glycation, or rather glycosylation, pardon me. This is a normal, necessary enzyme controlled process. And what happens is the body will attach a sugar molecule to a protein or a lipid in a very precise, regulated fashion. And this plays an essential role in nearly every aspect of cellular communication, right? Immune recognition, protein function, all those types of things fall under this glycosylation umbrella. Glycosylation is crucial because it helps you to surveil immunologically. And what that means is proteins on the surface of our cells, like immune cells, are glycosylated, meaning they create these little molecular flags. They help your body distinguish between the self and the non-self. One way we do this all the time is we glycosylate or label an antibody. And that helps us determine how much will interact with immune cells like macrophages, other cells, natural killer cells. And those sugar tags are basically a way to modulate how strongly that antibody will work. We need that antibody, right, to trigger inflammation and clearance. But without glycosylation, our immune system would remain naive. It would lose much of its specificity and control. But let's contrast that normal glycosylation with this problem child, this idea of glycation. This is entirely unregulated. It's a non-enzymatic reaction. And that means it doesn't require any enzyme. It just spontaneously happens without any oversight or precision. Glycation happens when a sugar molecule like glucose or fructose randomly binds onto a protein or a lipid, even nucleic acids like DNA. So this might get a little bit into the weeds a bit, not a ton of chemistry, and there's no test at the end of this for your audience. But what happens when a sugar attaches onto a molecule is it forms an unstable intermediate called a Schiff base. And then it rearranges into a more stable structure called an Amadori product. Again, no test on this at the end. But over time, in cases where there's oxidation or persistent hyperglycemia, too much sugar in the blood, those products undergo irreversible reactions, and that's called a glycation product or an age. So
Mm.
again, unlike glycosylation, glycation doesn't serve a helpful biological purpose. In fact, its modifications are so harmful, they are the ones that perpetuate inflammation that's kind of lurking behind the scenes.
So inflammation, good and bad. Acute inflammation is good for the body. Uh,
Hmm.
Chronic inflammation is what leads to long-term issues. Glycation is always bad. Is that a fair assumption?
I think that's a very
And
good
and
assumption.
my
Yep.
my brain, like I can think very simple, but that's kind of what I took away from
Yeah, I
Absolutely.
agree. So basically, sugar is the kind of the root cause of what you would say is chronic inflammation.
That's
Or is
right.
it
That's one of
just,
the
I mean, there must be other things too, but sugar is a big one.
Sugar is a big one because when you glycate proteins or you form these ages, what they'll do is they'll interfere with the normal function of that protein. They may distort the structure. They could reduce some flexibility. They'll create debris that the cell struggles with. Um, you know, those glycation products, all going forward, refer to them as ages. What they do is they're little troublemakers. They cause havoc in the cellular machinery because they can bind onto a receptor for ages. That's called RAGE, and they'll go through a very specific signaling program. Some of your audience might know about NF-kappa B. That's one of the main regulators of inflammatory molecules like cytokines. And that, again, is that chronic inflammation that may become worse over time.
I have a question. Can you dive into maybe a little off topic, but maybe not? Um, just the addiction to sugar and the body's addiction to it mentally, physically, and how that plays a role.
Yeah, absolutely. That is an issue because we as a species do crave carbohydrates. You never really see someone hanging out watching Netflix with a big stick of butter snacking on that thing. It's just not what we do, and our brain does crave carbohydrates. It's no surprise, therefore, that carbohydrates represents a significant portion of our diet today.
Yeah, I'm pretty sure this is a study that I read high level that they did a study on rats and compared it to cocaine and sugar. And they
Mm.
said that the rats responded heavily and were more addicted to sugar than cocaine. Have you seen that study by chance?
I have, yeah, and there have been a few kind of tangential ones that relate to the same outcome. So that's a compelling aspect. We may talk later about GLP-1 and what it does in that whole scenario, but yeah, the cravings are things that we definitely struggle with.
Is there a
Yeah.
difference between when you're talking about sugar? Because in my mind, I always go to like whatever's natural is healthy. So
Mhm.
like, when we say sugar, like really the majority of the sugar in our diets are probably like from processed stuff. So it's like kind of like the chemically like more less natural sugar, like corn, like fructose corn syrup, high fructose corn syrup and stuff like that. Whereas like when I'm thinking about more natural things like honey or I don't know what other sugary like fruit and stuff, like I imagine hopefully that's like okay to have that, but then maybe when we're talking about what you need to not include in your diet, I'd hope it'd be the other ones, right? Is there a difference there when you're talking about sugar and carbs?
There is, and you nailed it. It's the highly processed things that we want to get around or avoid entirely. Their sugars will come in lots of different varieties, and our liver will make sure that we have the appropriate amount of glucose in our blood, no matter what. As an experiment, we may decide to eat no sugar for weeks on end, but you'll still have blood glucose levels measurable because, again, the liver will ensure that's appropriate. The issue, though, with the highly processed foods is the excursions, right? The big spikes that will come over time. While that's a momentary kind of spike that will lead to issues with regard to insulin sensitivity first, but secondarily glycation, it's the long-term exposure to the glucose that we need to avoid.
Mm.
Can I ask, this is a little bit more personal.
Mhm.
I had a blood panel done about 3 weeks ago, and Katie knows about it. It was pretty alarming because my lipid profile, my triglycerides, my cholesterol were all abnormally high.
Mhm.
Uh, I eat a lot of red meat, lots of red meat.
Yeah.
What role does saturated flat fats play in sugar and inflammation? Because
Well,
one
it
one of the feedbacks was, are you consuming more saturated fats than you typically do? And I don't think I am, but I that was brought up in my clinical presentation. So I'd love for you
mhm.
to dive into that.
Yeah, that'd be great. So, Josh, the issue here is that we're faced with a lot of dogmatic understanding about fats, cholesterols, etc. So, putting that to the side for just a moment, these molecules are not considered to be as inflammatory as what the historical record might kind of convey. So, I'm similar. I eat a lot of red meat, very low carb, and the inflammation is not really related to that aspect. It's the excursions that I'm trying to avoid, those cravings that we just talked about a bit ago. But I'll maybe touch on that a little bit more as the conversation continues. But the fats I would not be too concerned about.
Okay,
Mm.
that's good. Because I love my red meat. I would never
Yeah.
stop eating it. And you're right. You were talking about how sugar in your body, like with certain markers like A1C, it's a long duration of time that you're actually measuring. And so it wasn't easy for me to just go back and say maybe it was the last 2 or 3 days of foods. It could have been the last 90 days of foods. And I did have a little bit of a period where I was eating sweets at night. So maybe that is a contributing factor.
Hmm. Yeah, well, it's interesting. If we can go down the rabbit hole a bit on the history of glycation, again, I think it's not new.
I would
Uh,
love.
it's it's been around as life has, but our understanding of it is for sure more of a recent study or recent story, I guess. Um, if we were to go back, I think it was around 1910, 1912 or so, there was a French chemist. His name was Louis Camille Maillard, and he stumbled onto the process of glycation because he was very interested in understanding how amino acids and sugar react when they're heated. He wasn't at all, I don't think, imagining the impact on human health. He was much more interested in the browning of food, like the crust of a bread or the sear on a steak. I was thinking of that, Josh, as you were talking about the red meat. But it turns out, Maillard reactions, as they're now considered, isn't just a kitchen phenomenon that he discovered. It's the same chemistry that forms these ages in our body. So that's kind of the beginning of our kind of understanding of how it works. And then fast forward in the 1980s or so, scientists started connecting the dots, right? They started to see that glycation and disease hold hands. There was a landmark paper in the New England Journal of Medicine in mid 1980s that showed that ages were piling up in diabetic patients. No one really knew why, but the connections or the links between glycation and diabetic disease started to become more apparent, especially when you look at the kidney damage and the vascular stiffness those folks experience. Now, this wasn't just a sugar problem, it's a chronic sugar problem. And that's kind of where the story shifted. In 2004, 2003, somewhere around there, there was this pivotal moment where folks started to implicate hemoglobin A1C or HbA1c, which, is the glycated form of hemoglobin in diabetes. And that was in circulation research. A1C became a game changer, right? We use that all the time. It's appropriately used for monitoring blood glucose control, revealing how, glycation reflects long-term glucose storage. So ever since then, these ages have been, segueing from this diabetic story into the areas of Alzheimer's disease, heart disease, plain old aging. All of these relate to the abundance of these ages. And that's the trend that we're looking at today.
It's
So you're
amazing.
saying obviously whole foods, less refined carbs, but then
Yes.
are you also saying don't crust, don't like caramelize or crust your meats, or what are you saying there?
Yeah, yeah. So that's where my personal kind of tastes maybe conflict with that statement. I believe that the liver will clear nearly all of the ingested um, ages. In fact, only about 6 or 7% of all the ages that we consume are actually retained and may have an impact on our basal inflammatory reactions and long-term health, meaning the liver's doing a great job clearing most of those. So continue to eat meat. I will sear my steaks. I'll do all those types of things. That's not a problem. The issue is the reactions, de novo reactions that happen in our body. The more we lean onto processed, sugar heavy diets, the more ages we'll shovel in because our body is, honed to make them that way. And the data backs all that up, right? Over the last century, sugar consumption has skyrocketed. I
Mhm.
think I read somewhere, around the turn of the last century, around 1900, the average American ate maybe 5 pounds of sugar a year. Today, it's closer to about 130 pounds,
Wow.
26-fold increase. So yeah, are we eating, steak and a pastry sparingly, maybe on your birthday? That's fine. Um, I've spent some time living in France once upon a time, and I'd love a baguette in hand and walk in the city. But the bigger issue is the refined carbohydrates that we take into the body and then internally synthesize those ages.
Okay.
So is there any correlation to that statement is extremely first of all, it's crazy how much sugar we're consuming now. Is that directly tied to the inception of processed foods? Or is it, I mean, do you have any depth or understanding of when it really took off?
I would agree with that. The advent of sugar on the European continent was around the Norman Conquest, if we go back way far. And there are some discrete, discernible kind of craniofacial changes that we experienced as we transitioned from being mostly a nasal breathing species to more kind of a higher sugar, more stressed out, sympathetic breathing species, meaning through our mouth. So there is a huge story there anthropologically, originally, but yeah, the abundance of these very fast and convenient foods is not without a cost for sure.
Well, and
Wow.
it's interesting, and you've seen, especially in the last year, this mom movement, and
Hmm.
you've seen people like Casey Means and Callie Means really come onto the scene, and they're all talking about our food system, and you almost wonder if there's some direct correlation to the companies dumping more sugar in, because we just talked about how addictive it is to keep them coming back.
Right, right. Well, there's no surprise that once the crosshairs focused on big tobacco, most of those entities bought up food companies, and the
Mm.
same types of axes are employed as Katie mentioned early on with the addiction aspects. There's a story there for sure that needs to be further clarified.
Amazing. I think this would be a really good segue to dive into our biomarkers and
Hmm.
inflammation and glycation and how it plays a role, and maybe some high level thoughts on biomarkers that people come to us for all the time: testosterone, estrogen, progesterone, uh,
Hmm.
ApoB, cortisol, our inflammatory marker. Could you dive into, the roles that those all play?
Well, I was
Yeah.
going to ask too if we could start getting into questions, and that is one of them. Like, first of all, like
Okay.
what biomarkers do you check for inflammation is a big important one, and then are there biomarkers for like heart health or cancer prevention along with that?
Absolutely. Yeah. Let's dive in. If we could set the stage first off by hammering home once more this idea that inflammation and glycation are holding hands in the process, I think that might set the stage well for many of the markers that you guys look at in your panel. I've seen the array of all the markers, they're great, and I'd love to chat about some of those, especially those specific ones you've mentioned. But before we get into that, just a thought or two about HbA1c. It's everywhere, right? I mean, people learn about it maybe for the first time on a commercial on TV, talking about a drug maybe. But historically, obviously, this idea of glycation was viewed as really a problem mostly confined to people with poorly controlled diabetes, right? Chronically high blood sugar levels clearly accelerate age formation, among which, hemoglobin is one of the proteins impacted. Now, the most important, I think, maybe earliest clue at that connection was this A1C story. So, as your audience knows, hemoglobin is the molecule that carries oxygen throughout the body, and under conditions of chronic high blood sugar or hyperglycemia, glucose molecules start to stick to it in that same pathway that I mentioned earlier. So, glycated hemoglobin or A1C builds up over time, and that does provide a really nice snapshot for a person's average blood sugar levels over, maybe about 3 months. And that relates to the lifespan of a red blood cell in circulation. So while A1C became, kind of a cornerstone in the diagnosis and management of diabetes for patients and clinicians alike, it's also a powerful tool because in a single blood test, you can reveal whether blood sugar has been consistently high, even if it looks low at the moment, right? Lots of us wear CGMs or other means of immediately detecting glucose levels, but A1C is going to give a clearer picture over a longer period of time.
And where would you like to see A1C optimally?
Yeah, so currently the kind of thresholds is above 5.7% to about maybe 6.4%. That signals pre-diabetes. So you're getting a little higher if you're over 5.5 or so percent of all of your red blood cells hemoglobin. Over 6.5%, that's the clinical higher level that does confirm the diagnosis. But what I really want to impress on your audience and anyone else that'll listen to me for the next moment is it's more than just numbers, right? These values tell a story about your metabolic health, whether the body of symptoms appear. So let's make up an example. Let's imagine there's someone that comes to Blokes, gets a blood panel. Her name is Sarah, we'll say, and she's a 42-year-old office worker. She feels mostly fine, but she's noticed, some creeping fatigue over time, stubborn weight gain that she just is annoyed with, and maybe brain fog occasionally. So let's imagine she goes in for a routine checkup and her fasting glucose levels are, a reassuring, let's say 98 or so milligrams per deciliter. A little high, yeah, but it's normal, technically normal. So let's imagine the doctor then orders an A1C test to take a deeper look, and the result comes back at 6.1%. And what that does is it reveals that while her morning glucose level that day may appear acceptable, even commendable based on her history, her overall blood sugar exposure is running high. So, unbeknownst to Sarah in this case, she's in the early stages of prediabetes. Glycation is already working quietly behind the scenes. So, I think that A1C in her case is valuable because it serves as a real time indicator of glycation. But this is the take home. It's much more important than that. It's not just a kind of a blood sugar report card. It's also, A1C is also a proxy measure. So it reflects glycation happening everywhere. If hemoglobin is becoming glycated, a clinician can use a CPT code, they can bill it, they can evaluate it. That's great. But there are countless other proteins throughout the body that are also being glycated. So again, A1C doesn't just tell someone that they've got a high sugar problem, it signals that there's a systemic acceleration of glycation related damage. And that's probably before Sarah even detects any diabetic complications.
Okay.
We have a question in the chat that's somewhat tied
Yeah.
to somebody asked about A1C and eating nearly carnivore. Why would that go up? Is there any metrics to that or tied to if you're going really, really heavy meat?
Yeah, so there are some connections, and that's very astute of the person there in the chat. So here's a thought or two on that. Remember, this is a percentage of your total hemoglobin that's glycated over the lifespan of your blood. What happens to an individual that, based on distance training, or they're more, they're doing some high intensive interval training, for instance, red blood cells may live a bit longer than the average person in that case. In such a condition, A1C levels will steadily, creep upward to a higher level. So this is one measure, but it's not the only measure. So that's kind of why the carnivores and the low keto folks among us may have on occasion a slightly outlier situation in our A1C levels. And I think that's directly related to that false positive because the red blood cells are living so much longer.
Wow,
So,
that's interesting.
so
Because they're actually they can be you can be healthier because you have those good lifestyle, but still
Yeah,
your A1C is not showing that.
right, right.
Oh,
but in a clinical setting, and maybe
Mhm.
you don't, would there really be any reason to panic or even try to treat that when it's just more that false positive?
I think that's true. Is there's, and again, I'm not a clinician or a physician, but there is less onus on an individual to be treated for high glycation if they're, fairly lean or they're athletic, those types of things. Yeah, there's really going to be a combination of lots of markers that might convey some change in a regimen.
okay, interesting. So then to follow on, Celeste is asking if
Hmm.
A1C and fasting insulin could not agree with each other. So if A1C was pre-diabetic, would it be possible that their fasting insulin would be normal?
Yeah, that's right. So what we'll look at maybe next is a series of different markers that you guys screen and others should be screening. And one of those would be insulin for sure, because the A1C insulin ratio is something that I think can be quite informative,
Mm.
right? If you have high A1C, but you have low insulin, that might convey at some level some impaired pancreatic function. If you have high insulin with normal A1C, that's, a good sign that they may have early insulin resistance, and further inspection should be, following up with that. But all of this helps to pinpoint the stage and the nature of their metabolic dysfunction.
Okay.
So there's some ratios that we can look at after we navigate a few of the markers that might be helpful.
Okay.
Amazing. I would love to selfishly, I'm a nut on testosterone. I'd love to know the role of inflammation and testosterone in the body in both men and women. Obviously, women have plenty of testosterone, so it's not just a male thing,
Hmm.
but that's one of the areas we treat a lot, and we see a lot of suboptimal testosterone levels.
Yeah, absolutely. It is a current phenomenon for sure. There are many markers that are related to the hormonal control of inflammation. Maybe we'll talk about cortisol in a moment, but the sex hormones do have an important story to say. So let's look at it. First off is testosterone, right? So the origin, as you've noted, Testosterone is primarily produced in the male's testes, but also in the ovaries of the females. In addition, the adrenal glands can also elaborate some testosterone or general androgens. So testosterone has an anti-inflammatory effect, and what it does is it reduces pro-inflammatory cytokines. One of the main ones is TNF alpha. So sufficient testosterone levels does have an anti-inflammatory impact organismally. It can also reduce visceral fat using some of these same axes. But the relevance of looking at it in a panel is maybe as follows, right? If you have low testosterone, that is directly tied to a metabolic syndrome type situation, metabolic compromise, and it can increase or at least lead to the increased secretion of inflammatory markers. One of them is CRP, right? C-reactive protein is a good measure of systemic inflammation, and low testosterone individuals have a tendency to have elevated CRP. I think, therefore, there's some good value in looking at both of those in a larger panel. Maybe as an extreme, among the aging population or hypogonadal individuals, they'd have lower testosterone. Again, they're all going to, by and large, have higher CRP levels. But normal insulin, or rather normal testosterone, will increase insulin sensitivity, leads to better sugar balance. So I would agree with kind of the field in saying that inflammation as it relates to testosterone is, proven science. But let's not forget behind the scenes, if you have better insulin sensitivity in a normal T individual and therefore better sugar balance, you're not going to have that extra fuel that you throw on the fire in the body and cause excessive glycation. Remember, ages, when they accumulate, they do bind to receptors and trigger the same types of inflammation we've been talking about. So that's one, to testosterone. You want to do some estradiol stuff?
For
Well,
sure.
yeah, I do want to know. You're going to be selfish. I'm going to be selfish. Like,
Love it.
why? I
Love it.
know that menopause will increase inflammation in women. So wanted to understand, is that somewhat related to testosterone lowering, or is it something else, or all of it
I,
above, the
I,
above?
I, I think both. And again, I'm going to sprinkle on this idea of glycation at the very end, a little garnish onto the story of what estradiol is doing. Estradiol is produced mainly in the ovaries, right? Smaller amounts in the adrenal glands, and the fat tissue that we have also can be a source. Now, estradiol is interesting because it can have both a pro-inflammatory as well as an anti-inflammatory effect. It really depends on the levels. So let's imagine you've got a gal, she's got optimal levels. What that's doing is it's reducing pro-inflammatory cytokines. A lot of the interleukins and tumor necrosis factor, TNF alpha, can be kind of mitigated, if you will. And if it reduces pro-inflammatory cytokines, it also helps to elevate the anti-inflammatory ones. I'm thinking of IL-10 as one of the main anti-inflammatory molecules that in a normal estradiol secreting gal, she'll have a little bit more IL-10 available, which is helpful. But when there's low levels, what that does is it increases inflammation because it reduces its anti-inflammatory effects. Whoa, that became a tongue twister for a moment. So we're basically going to tone down on the anti-inflammatory effects, and in the end, obviously, the inflammation elevates. That can be due to stress, it could be due to even over-exercising, birth control. All of those lead to, in tandem with estradiol, increased CRP, increased NF-kappa B, and even some autoimmune flares that gals experience. So I think monitoring estradiol will help us understand its role in inflammation, particularly in postmenopausal women. But again, at the end of the day, low estradiol will make blood sugar levels rise easier.
Mm.
Therefore, it'll elevate our insulin resistance. We're saying no more to taking up glucose. Glucose in the blood and in fluids will then cause age formation. So kind
That's
of a
kind of like what
double-edged
I
sword.
hear normally, like mostly on the day-to-day basis, is women saying, like, I haven't changed anything, like nothing's changed with my diet, like, but all of a sudden, like, I have that extra weight, or I'm not feeling, I don't have as much energy. So that's clearly an internal, thing when we
Right.
use our estrogen, right?
Absolutely.
I
Very cool.
I have a question on the testosterone again. Is
Hmm.
there, because we know it is good, and is there a point where it's, physiologically levels that are way beyond what we would consider optimal or normal, where there's a diminishing return in inflammation?
I'm not
Hey,
entirely
for
sure about
example,
a value, but
bodybuilders.
yeah, right. I mean, I guess there is a threshold you'd meet to where you're causing more harm than good. Um, but I'm not aware of any particular level that is, massively detrimental. I may need to get back to you on that one, but
Yeah, that's
it does seem that if you're bridging into the gap of anabolic steroids and other kind of artificial ways to raise testosterone, and that is fraught with some major dangers. So
Mm.
lots to come.
one of the things.
Okay.
Oh, go ahead, babe.
Oh, I was just going to say, Lisa's asking, it kind of goes back, we were talking about this before, but about high inflammation, is there a suggested macro ratio to follow? She said she doesn't have insulin resistance or diabetes and eats fairly clean, but just does she need to worry about the percentage of carbs?
I'm a firm advocate of carb restriction. I understand how our bodies work and our cravings, so I don't think it's tenable to assume that we can eradicate carbohydrates entirely from our diet. I would just caution controlling the carbs would be helpful. One of the biggest gateways to glycation for the day is a high carb breakfast, right? We wake up, that's a perfect time to kind of delay breakfast a bit and maybe extend your fasting just a bit. But when you do break the fast after sleeping through the night and you can do so in a low carb environment, that will set the stage for some better outcomes throughout the day.
Is
So you are a fan of fasting.
Yeah, yeah. Intermittent fasting is wonderful. What it does is it prevents all these different spikes of insulin and glucose in the body, gives you a chance to reset, become a bit more insulin sensitive. And keep in mind, insulin sensitivity and as opposed to insulin resistance has a clear metabolic impact on the body. But in the back of the room here, we're also looking at that troublesome age glycation product. If you have more insulin sensitivity, you'll store glucose better. There won't be as much glucose available for glycation on the back end.
have you seen a trend that was relatively started by Peter Attia and Chris Hemsworth where they fast for I think it's like 4 days, maybe it's a little bit longer.
Mm.
What's your thoughts on that tied to this whole field?
Well, I can only share my personal experience, and I too have done, I'll do a 52-hour fast periodically. Most of that is because I just like to stay busy and I don't like stopping to eat on occasion. But I've seen there's some there's some great metabolic benefits that I've experienced. So I sometimes track my glucose in real time. That's been encouraging on long fasts like this. Keep in mind, I think for me, and I think for anyone that wants to do it, it's key to have the electrolytes available. So while I'll do, a harder fast in the first 24 hours, I do sprinkle in bone broth and electrolytes and other things like that on the back end. I think there's value to it. Again, as Ben would mention to your audience and anyone else, if you give him 6 or 8 hours, he can make you insulin sensitive like that. The
Wow.
problem the problem is he can also, in about the same amount of time, if you go overboard in the other extreme, you can become quite insulin resistant as well. So I just like to give myself long periods of time to kind of reset my cells and the axes that insulin employs, and fasting can be a great way to do it.
I
How often do you think is it a good kind of cadence to do that?
Um, I like to, several times a week skip breakfast and don't eat until lunch. So I already have that kind of 18-6 idea in
Mm.
place. Um, so I do that a couple of times a week. And those big fasts, I mean, again, there's no real rationale other than I just like to try it once a month. But I don't want to be viewed as a physician or a clinician that's advocating it for, X, Y, and Z reasons. Um, if it works for you, great, give it a try and see how you feel. If it doesn't, definitely don't hang your hat on that forever.
Disclaimer.
Yeah, yeah.
I've been one of our ambassadors, Eric Hinman, who's a big fitness guy.
Mm.
He got me into basically skipping breakfast and only eating a light meal at lunch. And I can tell you, it's been a game changer for my weight, obviously my diet, but my energy levels. Like I feel far more energetic throughout the day. So I definitely enjoy that, like eliminating that first meal. And I have my coffee. I can't deal without that. But I've noticed a really nice spike in my energy by fasting in that capacity.
Yeah, absolutely. Because you think about it, any type of a trigger, and we've talked about a few of those today, whether it be poor diet or stress, for instance, could cause chronic inflammation. And one of the things related to chronic inflammation is mitochondrial dysfunction, right? The fatigue that happens with disrupted energy manipulation. So, yeah, that's clearly a thing. Um, Imagine. Let's take a step back and look at glucose generally. There's really only three things that you're using glucose for right now. Number one, you're going to burn it for energy. That's all the cellular respiration stuff you've learned about in high school, glycolysis, Krebs cycle, those types of things. So you're going to burn it for energy. Number two, you're going to store it in anticipation of either a fast or some period where you don't have the nourishment. So you're going to store it. Insulin will help us do that. And the third and final thing is all the glucose that you don't burn for energy, store against the rainy day, and lose in your urine. What's left is floating around and will be used as a source of glycation. And that's going to cause that basal inflammation, mood, sleep issues, stubborn weight gain. All of those have primary causes, but it's worsened by this insidious thing in the background, this glycation story.
One thing that I've been dealing a lot with is sleep issues and stress issues. Um, I'm wondering how much is tied to my lipid profile to that, but I'd love for you to dive into something that I think most people, struggle with. I know Katie and I, we're always, first thing we do is when we wake up, we go, "How'd you sleep?" And I think a lot of times my sleep is directly tied to my stress levels. But
Mhm.
can you dive into that for our audience?
Yeah, yeah. Let's talk about stress for a bit. So, well, one of the markers in your panel is cortisol appropriately. That's one of the key markers, if you will, that kind of relates this hormonal control of inflammation. So let's look at that for a moment. As most in your audience would know, cortisol is produced in the adrenal glands, and it's produced in a response, if you will, to ACTH from the pituitary. So this molecule, cortisol, which technically is a glucocorticoid, suppresses inflammation in the short term. So it's good. Even though it's a stress marker, which most would talk about in the colloquial, it is definitely in the short term suppressing inflammation. And it does that because it inhibits the immune response and decreases cytokines. Those are the pro-inflammatory molecules. But in the long term, tracking cortisol over time is helpful. And that's where Blokes comes in because you can look at it as a trend over time. In the long term, cortisol is chronically pro-inflammatory. And it is so because it can suppress the immune system. So what's the relevance of that? Well, low cortisol could lead to unchecked inflammation. You see that in a clinical setting if an individual has adrenal insufficiency, they just don't make enough. They would have some unchecked inflammation. But tracking it still has value because you could detect whether the inflammation you're experiencing is a stress response, and unlike, an infection or something else. So one of the key things that glucose will do, or rather that cortisol will do, is it increases blood sugar. And that does so via gluconeogenesis, making new sugar. And remember, anytime you have extra sugar, you're going to burn it, you're going to store it, or you're going to use it for glycation. And, chronic stresses will lead to increased cortisol, which leads to increased glycemia, increased ages, and therefore inflammation. So I really am a strong advocate of assessing the balance between pro and anti-inflammation afforded by a cortisol test. And again, detecting whether it's stress induced. But then you can talk about the sleep issues, right? If you have this inherent stress aspect, the dopamine and the serotonin impacts, the circadian, all of that is related to cortisol levels and stress generally. So
Mm.
let's work together and cut out the stress.
Yeah, that's ideal, but something that I don't think a lot of us can figure out.
That's a
Um,
challenge.
Two questions. So one is same thing regarding the fasting and um, if your cortisol is low, would you still recommend fasting? That's kind of an interesting question.
Yeah, I think you not want to look at a few different kind of players in that story, but I probably would not recommend from, again, maybe personal experience, myself or others that I know that, close friends that have fasted. I wouldn't recommend maybe the long-term fast like that, but the intermittent aspect of skipping a meal, I think definitely would still be an appropriate path to take, even if your cortisol levels are low.
And I also wanted to ask this before when you're talking about fasting for men. I know Josh is a big fan of it too, but I don't do it because I do feel like it's for women in a certain stage, perimenopause, menopause. I think it can be harder on us to fast, right? Because again, when our estrogen's lowering, I think estrogen is a good stress hormone. And
Hmm.
so if we have to rely more on cortisol, um, I believe that fasting could increase that stress response in a negative way for us, right?
Yeah, I mean, for sure. And you'll likely kind of based on our kind of personal tendencies on how much we enjoy the fast and cravings and all those things would probably bypass that and, start to break fast earlier. But yeah, the militant among us that fast extensively, you probably want to be careful with that when you consider the estrogens and the waning estrogens with time.
Okay. Amazing. Can we also dive into a little bit more about like GLP-1s, inflammation, insulin resistance? Chase is asking their doctor's recommending it, but they have reservations. So maybe you
What
can
what are they recommending? Like a GLP-1
a
agonist?
GLP-1. Hmm.
Okay. So let's just look at GLP-1 for a moment. So GLP-1 is an incretin hormone. It's a hormone released by the gut, specifically L cells in the intestine. And it really can be reduced into two main kind of areas of biology. Number one, what it does is it starts to slow down gastric emptying. So it slows down the motility in the gut. And essentially, what that means is it makes you feel fuller for longer periods of time. So, what does that do? If you feel full, you have a tendency to stop eating. The issue with some of the folks that take some of these GLP-1 receptor agonists, those are pharmaceutical grade agents that will agonize or activate the receptor. So GLP-1 isn't necessarily there, it's the pathway that's being activated. So you feel like you're fuller for longer periods of time. One of the problems with that is, although it's beginning now to percolate through the literature, there is an abundance of patients that have gastric paralysis. In the extreme cases, that can be fatal, meaning the peristalsis, the movement of stuff through the gut, slows down so much that it almost stops for some. And that's a problem. The second thing that GLP-1 will do is it impacts the brain and tells you that you're full. So you got the satiety feeling where you feel satiated, full. You don't really want to eat as much. I would just be very careful. I am an advocate of using biology to your advantage, but not circumventing issues pharmacologically if possible. What I mean to say by that is to suggest that if we take that kind of shortcut and try to mimic what GLP-1 is doing without probably restricting carbohydrates or doing other things that will naturally increase GLP-1, fiber, for instance, would do it. Um, what happens is you get so tired of the drug. I read somewhere that about 70% of patients that begin GLP-1 take themselves off the drug within 2 years of starting. And that's not because of the clinician or the doctor is pulling you off. They're just so sick and they just don't want to eat that they just can't handle it anymore. So you really need to be careful. Second thing is you will lose some weight, right? So because you're not eating and you feel as though you're full very, often, you don't eat as much and you lose weight. You do lose some fat, but a study shows that about 40% of the gain that you have when you go off the drug is adipose. It's more fat tissue that you're going to gain back. But 40% of the lean mass that you had originally is what you lose while on the drug, right? So you're losing bone and water weight for sure is in there, but bone and muscle and other things. And when you're my age, you don't want to lose bone and muscle very often. That doesn't come back very easily. So I think it's true that GLP-1 receptor agonist users 2 years later are still probably lighter than they once were, but they're much more obese because the amount of weight that they gain back is almost entirely adipose and they're not gaining back that lean mass. So there's a
Well, I think it's very
story.
important when you're doing it. That's why it's so important to change your habits when you're on GLP-1, right? Like you don't want to lose anytime you lose any kind of weight
Right.
quickly, you're going to lose the muscle and the fat. So that's why it's super important to focus on protein, cut out the, processed foods, highly refined carbs, so that you're not losing. Because at the end of the day, muscle is a big part of how you metabolize or how your metabolism
Hmm.
works for you, right?
Right. Absolutely. No, that's totally true. And let's not lose sight of the fact that while, GLP-1 is doing its thing, impacting your metabolic profile generally, although transiently, I would argue, behind the scenes, we've always got this set of glycation stories that are also kind of working against you. We spent most of our time talking about kind of the metabolic aspect, but the ills of a sugar-based glycation issue spans much beyond metabolic processes only, right? So we could talk about what it does in the brain. We could talk about cardiovascular. I think, Katie, you mentioned cancer. So there's so much that this glycation slash inflammation story can impact that really it makes you take a second look at it.
We I can't remember who it was, but it's a doctor thought leader um said that if he was diagnosed with cancer, the first thing he would do is he would fast for 10 days. What's your thoughts on that? I mean, obviously the role of inflammation is what I'm assuming he's trying to reduce in the body.
Yeah, absolutely. It's the inflammation idea. Who could I make it 10 days? I guess if my life was on the
Long
line,
time, isn't it? I
it
was
is
like,
a long
I
time.
don't know if I could do that.
Yeah. Well, is an interesting approach. I would for sure go on a major carb restriction. In fact, carbohydrates or glucose generally, I can't remember who the person was, but there was a Nobel Prize awarded in the 30s based on some research that was done, 1930s, based on research that was done on how glucose is one, or carbohydrates generally is the main cause of cancer. It is the agent that feeds cancers, encourages their growth, exacerbates the inflammation locally, and in the process creates new blood vessels to that area. All those things that we're trying to avoid, right? So there is a role there for sure.
Wow. You mentioned earlier we talked about stress. What do you do to deal with stress? I mean, you're in a very intense educational background. What are some quick tips that you have for people to just try to manage their stress levels a little bit better?
Well, if you know Ben Bickman and myself, we are definite advocates of really cheesy dad jokes. So if you can access those, that is going to move the
The
needle.
laughter.
That's right. Laughter is good.
Do you
Um,
have one for us?
now I'm on the spot. Um, actually,
Maybe someone in the comments has a good dad joke for us.
well, I will say that my 8-year-old I'm rubbing off on a bit. She gave me one the other day. I'll give it to you real quick. This is one. It's a knock knock joke. So I'll do it and you have to respond. All right. Knock knock.
Who's
Who's
there?
there?
Little old lady.
Little
Little lady.
who?
I didn't know you could yodel, Dad, is what she said. So there's one for you.
Okay,
So
I like it.
some laughter is good. That's helpful. Some of the other things I like to do is, and I've hinted at it a little bit, kind of the advocate in me would say, um, I would definitely recommend some morning sunlight and movement. I think it does a lot to get out in the morning in the sun to kind of sync your circadian rhythms, your insulin sensitivity, especially if you haven't, woken up and first thing pounded 2 bagels or a donut. So if you've intermittently skipped that meal and gone on a walk, I think that's helpful. If when you do break your fast, you have a protein rich, low carb breakfast. I'm just a straight, bacon and egg or sausage and egg type breakfast when I do eat it. I've found, and the literature supports this, is that a high protein, low carb breakfast can prevent the midday crash much better than otherwise. And in the process, over the course of the day, lower the burden of glycation. One more thing I think that really would help is I am an advocate of about 5 to 10 minutes of either mindfulness or meditation, just some kind of a reset where you just pause, you ignore what is in store for the day for just a little bit. I think what that does is help you get on the path of detoxifying, kind of gets your digestion working. When you either meditate or have mindfulness, you shift a bit away from the sympathetic. That's the fight or flight part of our autonomic nervous system, and you're more prone to have the ratio shift toward the parasympathetic, where you're resting, you're relaxing, you're digesting.
Mm.
If I were to put the hat on of the pulmonary guy that I used to be exclusively, again, mouth breathing is conducive to sympathetic activation. If you're a veterinarian, for instance, and you're driving down the road and you see, a cow or a horse and they're breathing out of their mouth, what would you think? That animal's sick, right? So the more we breathe out of our mouth, the more likely are to be in a sympathetic part of the story. So nasal breathing, nitric
Mm,
oxide, lots of things helping you. If you just pause for a bit before you start your day,
amazing.
I think you'd be impressed with that.
Amazing. That's what I wanted to hear. Let me, what personally, I do sauna almost every day, dry sauna,
Love it.
180 degrees, 15, 20 minutes. Tell me your overall thoughts on that and just inflammation and how it plays a role.
I think both extremes are quite helpful. So when you deal with some thermal aspects of treating the body, you're going to encounter some great anti-inflammatory situations. First off, if you were to do cold plunging, that is very clearly related to an anti-inflammatory impact. You're kind of decoupling the thermogenin part of the story. You may shiver a little bit, and in so doing, kind of shift toward more of a brown adipose fat biology. So there's definitely a role in an anti-inflammatory sense and low glycative sense to encounter some cold immersion therapy, number one. Secondarily, also the heat is something that shows something that's similar, right? You can have some anti-inflammatory aspects. You can have better insulin sensitivity with heat treatment. So I'm a big champion of that. I love it.
Amanda says she's read that women should not cold plunge, and I've thought about this a lot too as someone who's tried it.
Hmm.
I do feel like it's good sometimes, but I need it not as cold as Josh. And so for me, it's like I listen to like what feels good,
Yeah,
maybe like how I'm feeling, if it's the right time for me in your cycle or not, and then having it less stressful, but it does feel good, but just at a certain temperature. I don't know if you agree with that.
absolutely. No, I agree. I think Josh is the type that gets up in the morning with his pickaxe and chips off all the ice and then gets in. I may not be able to do it quite as cold like that, but I think just a bit of a change from to be cooler for a period of time has some advantages. Tom Seeger at Arizona State, he is a guy that runs a company, Moroska Forge, the
Oh yeah.
cold bath, and he just came out with a book and it talks about estrogens and testosterone levels as they relate to cold immersion therapy. And in that book, lots of great information, but there is an aspect where you need definitely, Katie, you got to listen to your body. If you can get a little cooler for a period of time, I think there are some advantages. But if you get out and you're just a big cube of ice, that is not helpful. So be careful there.
I think there's a little bit of male ego too, that the colder the better. For the record, babe, I like it a little bit warmer too. Like I don't even at 37 degrees, but when I'm with all my buddies, it's all about how cold is it, you know? So I
That's right. Yeah, if
uh
you're a Joe Rogan type and can do your whole podcast in the cold like that, that's
Did they do a whole
ego.
podcast in the cold?
No, I think he does pretty cold though.
Oh, geez.
Yeah.
Yikes. All right. Well, this has been awesome. Like way more information that I knew could come out of the topic of inflammation. And I'm sure that there's more to do too. So I'd love to talk again more, more at another date because this was so awesome. Very informational. And you can
Yeah.
bring back some more dad jokes too.
I love it. I love it.
bro,
I'll
this is
start
amazing.
preparing.
Yeah, thank you so
Yeah.
much.
Thank you so much. We will send out some emails with like summaries too and like some tips that you kind of gave us here because it was so much information. We want to make sure everybody has that. But yeah, we'd love you back. Thank you so much for taking the time to do this and educate us.
My pleasure. Best
Thank
to
you
everybody
all.
there. Thanks,
All
guys.
right.
Yep,
Bye,
bye-bye.
guys.